Hello, everyone, and welcome. My name is Sierra Butterfield. Thank you for joining our webinar today, Security and Privacy Planning, Completing Your HIPAA SRA Before the End of the Year. Before we get started, I wanted to give you a couple of quick webinar tips. Throughout the webinar, we will keep all lines muted to prevent background sounds. If you need to get in touch with me, please use the chat feature accessible on the side control panel. If you have any questions that you would like our presenter to address, please chat them to me whenever you think of them, and we'll address them at the end. After today's session, you will receive an email from us. If you're interested in a copy of the slides, please let us know. And this webinar is being recorded, so we can send that out afterwards if that's how you would prefer as well. The webinar itself will take about 45 minutes, and we'll leave a few minutes at the end for a question and answer. And with that, I would like to introduce our speaker, Kirk Ising, and the topic for today. So Kirk has dedicated over 15 years of his career to working with providers and administrators on the growing demands of the healthcare industry. He has worked with many organizations and authored multiple market research reports. He is recognized throughout the industry for his ability to assist organizations in implementing technology to improve their success and customer satisfaction while meeting the demands of industry regulations. So with that, I'll turn it over to you, Kirk, to kick off our topic of security and privacy planning.
Awesome. Thank you so much, Sarah. I appreciate that. And thanks everybody for joining us today. Really appreciate the opportunity to chat with you. Just as we get started, here at Enterprise Health, we have several different functions, all focused on healthcare, cybersecurity, and compliance. Today, we're going to be speaking specifically about HIPAA compliance. But again, just know that if you're looking at other frameworks or managing other risks in the organization or looking for service work to help you guys meet some of those needs, let us know. There's a good chance we can help you out as well. So today, specifically, we're going to talk about HIPAA, security, privacy, breach notification, specifically around completing that SRA, how to get that done. Hard to believe, I know, but we're already in the second half of the year. Man, time is flying, but it's going to sneak up on us one way or the other. We'll talk just a little bit about Section 405D. If you're not familiar with it, don't worry. We're just going to talk about it briefly because I think it's an important heads up when we're talking about HIPAA and being compliant and really protecting patient information. We'll talk about some of the barriers. Again, it's important to understand that you're not alone. It's not easy to get everything done that's on your plate. So we'll talk briefly about that. And then we're really going to get into how to get the SRA done, how we can manage and help you guys with that process. Okay. Again, feel free to chat in those questions here. We'll let me know, and we can help those and address them either as they come up, or we'll catch them at the end, if that makes the most sense. So real quick, why are we here? Always like to include this. It's important just to kind of level set where we're at in the industry. It feels like we hear the same thing every year. Incidents are up 50% or up 100% year over year. And that's really what it's been. The amount of attacks, the sophistication of how folks, the bad actors, are getting at the information that us in our industry are challenged to keep protected. Keeps getting harder. You can see, covered entities, healthcare providers, business associates, again, a major part of this program, health plans, everybody's under attack. 138% increase in breaches compared to the first half of 2020. I mean, that's huge, right? In 2 years, jumping that much, we've got our work cut out for us, okay? And again, they're coming at it from a few different directions. So with that, obviously everybody's here, talk about HIPAA, excuse me. Federal mandate, it's all about the protected health information, right? We've got to keep that secure, whether you're the organization generating it, whether you're the organization that's helping the covered entity, you've still got that responsibility. Risk assessments are a huge piece. The security risk assessment, which we'll talk even more in detail about today, is a requirement, but you've got to know where you're at. You've got to have that foundation to identify where your gaps are. Once you have those identified, just like with the roadmap, you got the endpoint in mind. Now you've got to figure out what turns to take to get there. That's the roadmap. That's why risk assessments are so important. Obviously, there are changes more so on the privacy and breach notification side. state-specific guidelines, etc. But there's certainly changes to your environment, to the way folks are attacking. That's why it's important to continually do these assessments, to make sure that you're checking yourself against those changes, against the regulations. And of course, for those of you guys that are in MIPS and participating there, you have to do it in each calendar year that you're going to test for, or else you don't qualify. So just a little added incentive there on the security risk assessment specifically. A couple things. That risk assessment, again, get it done regularly. Annually is the most commonly accepted practice. Remediation plan. You've got to know, again, what you're doing to get to point B on that map from where you're at today. Policies and procedures, documentation, that's a huge piece of all of it. You know, whether you're talking about the policies and why you're doing things, whether you're talking about how you're remediating gaps, documenting what your business associates are doing. And just let me take a quick aside on business associates and those agreements. It's important to get those signed, to make sure that they're kosher, but we're also recommending that folks validate that their business associate is compliant. Unfortunately, we have ran into folks that have been signing business associate agreements for years and have not conducted a HIPAA risk assessment, are not HIPAA compliant even though they're signing those agreements. So just make sure and take into account that you've got some culpability, some stewardship requirements to validate that. Breach notification, this is in the news a lot, making sure that when a breach happens, unfortunately they're going to keep happening, how do you respond to it? Follow those policies and procedures that you have in place. Know where to get them first off, know how to follow them, and get that done. And we work with organizations of all different sizes, okay? Provider side, payer side, even that business associate side. HIPAA security, the rules are the same for everybody, right? But obviously, depending on your situation, you'll have different resources, some different internal needs to meet them. We're comfortable working with everybody, and it's important to know where you're at and how to get those pieces to fit together. Larger organization may have a HIPAA privacy officer who handles breach notification. Does everybody know where to get to them? Small organization, it's probably the office manager or maybe the IT guy, depending on how small the organization is. Do they know where to find the policies and procedures? Are they up to date on how to notify based on any changes to the state regulations or the federal regulations? Those are the pieces that are really important here, okay? Then obviously facilitate proper patient access. Patient access has been on the OCR's mind lately. Those are the guys that do the investigations for HHS and do the fines. So make sure that when patients request information, you're giving them the right information to the right person. Absolutely critical. Okay. Again, some of your responsible, certainly not an exhaustive list, but some of those highlights and those big rocks, if you will, that you've got to take care of. Okay. All right, let's step aside just a little bit from HIPAA for just a second, because 405D is still relatively new. This is out of the NIST folks in the federal government. They put together a task group. It collaborates, it's industry, it's government coming together specifically around cybersecurity practices, okay? HIPAA is a great first step in terms of cybersecurity. It is a requirement from the federal government, so you've got to do it, but it is not the end-all be-all in cybersecurity, right? You guys, I'm sure I'm preaching to the choir here. 405D is a step towards a true cybersecurity program, right? They call them frameworks. That's NIST, CSF, Cybersecurity Framework. That's HITRUST. Those kind of programs are really designed to help you measure cybersecurity. HIPAA is a great step, protecting PHI. 405D is a stepping stone from, say, HIPAA to that NIST, CSF, or HITRUST, wherever you want to go. That really helps up your protection game again for your data, right? Part of what they do, it's adapted from sizes, so small, medium, and large. have some different requirements, right? Just talked about HIPAA being the same requirements. 405D is more adaptive, okay? There's a link to the blog that we recently published on this. Get some more information on it. It's still relatively new, government regulation speaking, but it feels like to us that it's going to become more prominent. I don't want to say it's going to become required, but it is healthcare focused. And part of what they did is identify 5 major threats, okay, the top 5 threats. So here's where it's up to date. It's following with the cybersecurity threats, okay? Email phishing. This is not the good fishing you did with your grandpa out on the boat. This is the bad fishing, right? And it is super common. You've got to get the folks educated that have access to your systems to be suspicious of any email, right? Be suspicious, you know, err on the side of caution. Got to be aware of phishing. Ransomware. Loss of equipment, right? The old lost laptop that people could get information on. Intentional data loss, accidental data loss, somebody's looking at the wrong stuff. Can somebody jump from one system to another? And again, medical devices. This is looking like another big threat where they aren't as secure. Somebody can get in, go back in, or mess with somebody's monitor, right? There's lots of fears there. Again, 405D, it's not a requirement. It is a great step if you're feeling pretty comfortable with HIPAA, but want to take the next step in cybersecurity. Look at 405D, great step. When you're ready, go to a NIST, go to a high trust, and really start up in your game looking at maturity levels. But 405D, we think, is a great next step, just looking at organizations to better secure their data. And again, check out that blog. You'll have that link when we send it out as well. Okay, back to HIPAA. Thanks for letting me go on an aside there. Appreciate that. So, barriers. We hear this a lot, and there's lots of reasons people struggle with HIPAA compliance. Real quick though, we're going to open up a poll question, and Sarah will do this for us. But let us know when you're thinking of security and privacy compliance challenges. Tell us what the biggest challenges that you face are. So we'll just open that poll up here for a couple minutes. Give you just a little bit longer here.
Hey, Kirk, while you're waiting for that, you did get a question. Can you hear me? So the question is, if you have multiple EHR systems, do you need to have separate SRAs for each EHR system each year?
Awesome question, awesome question. So you don't need the answer is yes and no. How's that? Right, I'll be super helpful with that answer. They all need to be assessed. It does not need to be a full separate SRA, right? The full SRA, and we'll talk more about this in a second, it's covering administrative safeguards, physical safeguards, as well as technical safeguards. It's looking at the whole organization. A piece of that is the EHR. So that EHR piece, yes, would need to be replicated and done for each EHR system. And even beyond EHR systems, if you have a PACS, right, a lab system that's separate. If you've got a Epic or an Athena or somebody like that, a NextGen that does all of it, that's one. But if you add in a separate system where you're sharing information or you're storing patient notes, anything like that, each system that has ePHI in it, you'd want to include in the single SRA. So hopefully that answered your question. If I wasn't too long-winded and invasive there, we can do it again.
I think it was good.
Shoot me a note. Thanks. All right, so poll results, and I can't see them.
It looks like resources and budgeting at 63%, and then program management and enterprise-wide alignment at 47%.
Awesome. Okay, and that's, you know, it's funny as you read those out, Sierra. It's honestly that goes in the order. First, you got to secure resources and budget. Then you got to manage the project, and then what do you do with it at the end, right? How do you get everybody on the same page to actually implement and impact change? And hopefully you guys can understand you're not alone, right? Whether you're a small practice, whether you're a large organization, you know, a small practice is looking up saying, wow, they got all those resources and the people that are the compliance officers and all that. But it's the same challenges up and down the different types of organizations. You know, time. Where do you find the time? Because even if you're I air quotes around that, your sole quote unquote hat is being a compliance officer in a large organization, you've got so many things coming at you from a compliance standpoint. Or you're in a practice and you're the office manager trying to manage schedules and hiring while you're still managing compliance, right? Or you're the IT guy who's trying to keep the network up and then managing IT security. We get it. Process can be a huge challenge. We hear that one a lot. You know, how do I manage this process? Because it is, HIPAA is not just something you check a box, it is a process. Staffing, this is the last couple of years have been quite a pain point, right, is staffing, right? The great resignation, as they call it, and people moving around. Keeping up on staffing, keeping that continuity going. We've heard that one a lot. Tracking and reporting, that goes to aligning the organization, you know, the multiple locations along with multiple EHRs, like that question that just came in. The challenge here is, while these are all legitimate concerns and real world problems that you guys are living, not a single one of those get you off the hook when it comes to HIPAA compliance. There's still going to be a penalty if there's an audit, right? There's no HIPAA get me out of jail free because I'm too busy button. And I know that I don't mean to sound harsh, because this is the reality that you guys live in, small to large organizations, to payers, to business associates. We're all trying to do more with less every day. Got to find a way to fit it in, make it fit, right? So with that, we want to talk about software, because we're a big believer in software that services enabled, right? Or tech enabled services, however you want to flip that around. The combination therein of services and efficient software is where we see the biggest gains. So let's talk a little bit. Obviously, we've got our platform, but there are others out there. So we want to talk just a bit. When you're looking at SRA, and we use PBRA, Privacy Breach Notification Risk Assessment software, obviously it's got to be up to date. We talked a little bit about changes, state changes to the cybersecurity threats, changes to your organization. All that you've got to stay on top of. Do you have access to folks that are certified and knowledgeable? Again, you're looking at a software solution, you've got to have support as well from knowledgeable folks that are truly certified. Can you manage it all from a single place? Again, really helps in that administrative burden. You need the gap assessment. You've got to calculate the risk. Can you track the remediation process? When we talk about HIPAA, documentation is a huge piece of it. The old director for the audit department, OCR, he used to say, if you're not documenting it, don't even bother doing it, because we're not going to give you credit for it. That's paraphrased, but again, if you're not documenting it, don't do it. So for an example, you may have the best firewall out there, but if you don't have a policy and procedure that says, because of HIPAA reference, whatever it is, we have a firewall that is at least this level or higher, then it doesn't count when it comes to an OCR audit. And the reason is really simple, intentionality. Because with the policy and procedure that you can rely on, and with that documentation piece, it's going to say, all right, I'm going to keep moving. I'm going to doing it because I need to keep up to date on it, not because that happened to be what my sales guy sold me, and I'm going to sit on that for 5 years, right? Intentionality is huge when it comes to HIPAA, okay? And then, of course, reporting, knowing what you're doing, being able to communicate that out to the organization, whether large or small, that communication piece really helps with the alignment as you go through the process, all right? So we're going to talk about our approach. One thing I do want to point out as we go through this, we're going to have some screenshots that are examples from our system that really outline the process and how our software walks you through it, how our services are enabling it. But just to note, security risk assessment, that's the one we're focused on. Some of these slides will be from our privacy and breach assessment module, because the look and feel, we've made it the same. Again, trying to be efficient so you don't have to learn two things, right? Go through, have the same look and feel. Do security annually as you need it. Do your privacy breach notification assessment as you need it. May not be in the same frequency, okay? So we'll start with the process. Step one, we're going to gather information. All right, we're going to break this out into different roles, allowing you to delegate. HR, network, server, facilities, and then your HIPAA security questions. Database systems down there bottom, this is back to that question we had on EHRs, right? You're going to put in the different systems here to make sure that they're covered and part of the overall assessment, right? Now, some people are looking at this like, well, I'm going to be doing this all myself. Fine, the system is going to let you assign each set of questions to yourself, but it's still going to help you focus on one area at a time. Larger organization, you might say, I've got 3 people working on my network. All 3 of them can be added and take different questions in here to gather that information as efficiently as possible. Again, you don't have time to waste. So we're going to make this as efficient as possible to get all the data put together, okay? Overall, you're going to see the progress. If you're working with different folks, you'll see how they're progressing through the questions. They'll all turn green eventually, or you may have to push a couple folks to get back to it, but you'll have this view. You can be collaborative, flag different questions, making sure that you know how you're working together, all right? Each question, same look and feel. We've got the HIPAA citations, NIST references, the text from the HIPAA regulations there in the gray on the right, but we give an English translation to make sure that as you delegate, or if you're not a HIPAA expert, which most of us aren't, myself included, we know what we're looking for as we're gathering the evidence and the data, okay? Click yes, you've got it. The little red box there and attachments is going to pop up. We want you to upload that documentation. Here's a key point. The PMPs, the policy and procedures, the evidence that gets uploaded here, this is kept for minimum 7 years. We've been at this for a few years longer than that. We still haven't deleted because HIPAA can be assessed in arrears. So this is going to be your proof that at that time in that calendar year, I had policies and procedures. Here's the evidence that I was following them, all in one spot with the report. Okay, so just looking ahead, knock on wood, you never have to use it, but we've got you covered. Okay. Again, could be a yes, right? Maybe you don't have a policy and procedure that you need. Okay, or maybe the one you have is outdated. Click no. We're going to give you the option to download a sample policy and procedure that you can use. Also a great reference to best practices. We're doing a risk assessment, that security risk assessment, trying to get it done by the end of the year. If you end up addressing each item that's a no because you don't want to have a no in here, it takes way too long of a process. So we don't want to do that. Say no, document what you know, put in any notes, right? Flag the question if you want to talk to our assessor, great. Flag it and let's talk about it. But let's go through and move on, and then we're going to plan for this later, okay? Sometimes, not very often. In the security side, on a security risk assessment, some questions you may have an option to say it's not reasonable and appropriate. If you click that, note the red box there, you got to explain it. There has to be a reason. What are you doing instead? You got to document it. Working with our team, we're going to review that and make sure it makes sense. We might challenge you on it if it doesn't quite work, or if we see that you're clicking too many not reasonable and appropriate, we're probably going to push back and say, hey, let's talk about some of these, okay? You'll notice the flag icon in the lower left. That helps us work together, helps you and your team collaborate with our assessors as well, making sure that we're getting the very best data in here as we're gathering it. Now, once we work through that, right, everybody's got their piece done, or you're working through that privacy and breach assessment, once we've got all those pieces, now we move on to step 2. Okay, it's a couple things that happen here. First, working with our team, we're going to be reviewing everything, making sure that everything you said is compliant, is actually compliant, checking those things you said aren't compliant, and seeing, okay, do you have the right firewall? Then we just need the policy and procedure. Or maybe you've got the right policy and procedure, but your firewall's off, right? And let's talk through that and get a plan in place to address that. So the review happens here, and then we start the planning once we know for sure what is and what is not compliant. We organize everything that was determined to be a risk, high, medium to low. Those are determined through the NIST 800-S30 protocol. And then you got to get in and start planning what you're going to do about them, okay? Well, yeah, one note here. Want to make sure that we're on the right page here. Security risk assessment does not have state-specific regulations at this point. We know that can change. On the privacy side of HIPAA and the breach notifications, some states, several now, have their own rules and regulations that are more stringent than the HIPAA rules. In that case, our system defaults to the more stringent, whether it be state-specific or federal in the privacy assessment and the breach assessment. Really helpful just to have that all integrated together, not have to worry about it. Each risk, we're going to come in here. We've got to assign it to somebody, give them a target date, and then there's got to be an action plan. Compensating controls, we're going to list what we're doing right, get that credit in there, or what we don't have right. What we're doing differently, I should say. In here, as you work on it, really key that if you give us the email of the assignee, our system here is going to send reminders each week that say what they need to work on for HIPAA. Not perfect, because it is just an email, but it helps harass some folks so you don't have to do it all yourself. Keeps them engaged, doesn't let them forget that they do have to help with the HIPAA risk assessment, especially if they're in a different department in a larger organization. They're managing all the different hats they're wearing as well. Again, very simple here. Each risk, come in, do the same steps, save it, move on to the next. All the context, all the notes, all the attachments are all here with that link in the upper right. It says click here for question that spawned this risk. That's going to give you all the context. You don't have to go search through again and find a risk, an old policy and procedure. You don't have to reach out to the HR manager again and ask, hey, can you send over that example? Nope, it's all in the system. It's all here so we can plan quickly and efficiently, along with the notes from the assessors if you're working with my team. Okay, so let's talk then a little bit about so what, right? What do we do next? Once we've got the risk assessment complete, right? That's really those first 2 steps. Now, what do we do with it? We talked about that as part of the requirements of HIPAA, is doing something with the information. Simple dashboard here talks about the remediation plan, what's being worked on. You're going to move them from red to blue to green. Again, very simple. The letter grade, this brings us all back to some happy memories, some not so happy memories of the old high school and college days. Nice thing is here, the grade changes as you do the work. It's not a final grade, but as you come in here initially and you see how many risks you have, how many gaps you've got to remediate, that grade might be a little bit lower. It might look more like my report card than your report card. But as you keep working on it and get the risks remediated, that grade's going to move on up the ladder, and you'll be able to see some real progress there. Okay. Want to jump in real quick to what we call our action plan. This is where the work is documented, right? You'll see risk number 2 here. The employer policy and procedure, that's the action that's got to happen. In this case, it's assigned to George Washington. We've got his email, so he's getting reminders. We know that it's at the main organizational level, and we know that if we click on where it says risk, we're going to pop up all that context. So again, we assigned it to George. He might not have participated in the original assessment, but George is going to have access to all those notes from our assessors, from your respondent, as well as attachments. So again, they've got everything in one place. They can move on and get that work done. Okay, very simple. The other awesome part is, we'll see this in just a second, but this work is going to be included into the final report. I'll show you that here in just a second. So that report, again, we're done with the assessment, working on the action plan, but we've got a report here if somebody needs it, okay? This report is very detailed. It's got all the detail you don't want to spend time putting together. System's going to take care of it. You're going to have a really well-documented SRA report, or PBRA report as we call it, Privacy and Breach Risk Analysis. In addition to the findings, it's got the methodology. It's got all that stuff that, again, knock on wood, if an assessor and auditor comes to you and asks for it, you've got it all in one place with the evidence. I'll point out the very bottom there, that action history, Appendix E. The screen that we were just on, where we're entering the remediation efforts, we're bringing up the final results of that work. It's all appended onto this final report, so that in one click, you've got the report of all the findings, plus you have evidence that you're actually doing something with the assessment results. Absolutely critical when we're talking about documenting information for an assessment or an auditor later. And something you don't have to do anything to worry about, or you don't have to worry about it. It does it automatically, okay? Again, trying to be efficient, take things off your plate, go in, do it a few minutes at a time, get it done, and you've got the completed piece. You've got a way to track results all built in. Now, we talk about time, resources a lot. If you're a small organization, what we can tell you specifically about time is gathering the data, right? Which is where a lot of people get bogged down, okay? Using our platform, looking at an SRA, these are the times we're looking at. You know, the HIPAA security officer is going to spend a little more time on it. HR, IT, facilities, half hour. Somebody should be able to get those policies and procedures, grab the evidence, and it's off their plate at that point, right? Really makes a big difference, allows you to get that data together. The sponsor, the one who's going to keep the project rolling, they've got some more roles when it comes to planning, but there's no way to guess at that time just because we don't know how many gaps until we get through with that initial assessment. But again, very efficient use of the team's time. When we get into a large organization, there are some huge efficiency gains. We can't say exactly how much time it'll take, right? Because again, the size of the organization really makes a difference. But what we can say is that being able to assign delegates, multiple delegates to the network for different systems, those EHRs that we talked about earlier, PACs, whatever, really, again, keeps the total time needed for the organization on the calendar way down, right? Really efficiently spreads that out. We can manage multiple locations from that single SRA, just like we talked about doing with the EHRs or the systems that have the EPHI in them. We're not going to duplicate all that work, okay? One to many. We'll take it in a large organization. We can do that core assessment, and then we can push answers out to other organizations in the system, okay? Again, we can talk about that in depth one-on-one so you understand the efficiencies there, but I want to point out that this is a huge time saver, especially for a large organization. And then here's something unique too, unlimited user licenses. So if you need to assign remediation tasks to different folks throughout different locations, it's not going to cost extra because we know budget's important. You've got a fixed cost. Let's work within that, okay? So just to highlight efficiency gains, okay? We helped an East Coast health system about a year ago, a little over a year ago now. And I'll preface this before I get into the details. This is not what we want to have you guys doing or we want people to do, but in this particular case, we had a very large organization, over 200 locations, come and say, hey, we are out of time. We have to get this done for the organization. This is our deadline for completing an SRA. They hadn't started yet. This is the first time we'd worked with them. Again, over 200 locations. We completed a complete HIPAA Security Risk Assessment, and it was a great alignment. We were able to push some things around, get our team of assessors on it, and they were dedicated to getting us in that gathering data information phase, because they had a fire lit under them too, right? We completed the entire assessment in 3 weeks. Now, again, we don't want to act like this is normal, right? Typically, without that fire being lit, we see something like that taking a couple months, right, to get all those organizations in the different locations taken care of. But the point in sharing that is being able to delegate out, manage those locations, doing the one-to-many sharing of the data in the assessment, we can really, really bring home efficiencies for a large, complicated health system. And the same system is going to still work great for a small organization and fit their budget needs as well. So again, don't try it at home. Not the most recommended way to do it, because there was definitely fire lit under the organization on both sides, and we were willing to put that skin in the game and make it happen. So it was great success. But boy, it's a whole lot more relaxing if you have a month or two to get it done. So I want to talk too about how we engage with folks. Okay. We can do a self-assessment, use that software that I just showed you, take advantage of those systematic gains, right? And we can supplement that with a little bit of support to really make sure that you have somebody to go to when you have questions. Excuse me. So self-assessment, using those tools, walking through security or the privacy and breach notification, excuse me, something in the throat. The facilitated remote assessment. This is a great option. We're going to use that software platform, take those efficiencies, but then our third-party experts, our certified assessors, are going to go through and actually say what's compliant and what's not. So it's the third-party experts really knowing what you're doing is compliant or not with HIPAA. Okay, and then we're going to help and advise on what needs to be done as you build the remediation plan. And then we'll sign off on that final report and you'll go to work. Okay. Validated assessment. Here we're going to really lead the project. This is what I like to refer to as our white glove treatment. You know, we'll come on site if you want us to come on site. We're really going to go through and look at, do as much hands-on work as we can as we gather that data, really help in that phase, and then help you put together that plan, make sure that you have everything, including, you know, we can do an internal vulnerability scan, etc. Okay. So again, white glove. Some organizations really like that in terms of demonstrating to a cyber insurance company that it's a third party that's really getting in and gathering the data, or one of their partners wants that type of assessment. Again, the goal here is really to be audit ready, following the OCR audit protocol and the NIST guidelines. Okay. If you want to talk to us about it, let us know. We do have a special offer for the summer as well for you guys that have attended the webinar today. If you're either a current SRA, HIPAA 1 SRA customer, or you want to become one, with the purchase of an SRA license, we'll get you 50% off privacy and breach risk assessment license. Great deal. It's good through the end of August, so just let us know. I bring that up, and I think this is great. I talked a little bit about breach notification earlier. There was an organization, those in California probably heard about it. Maybe not everybody has, but I believe it's San Diego Family Care. Just settled one of 2 pending class action lawsuits for $1 million because they did not follow proper breach notification rules when one of their business associates had a breach. Again, their business associate had a breach. They didn't. I think it was NetGain, I think was who it was. They notified the practice, large multi-location organization. They didn't notify their patients timely enough. 2 patient class action lawsuits. The first one settled for $1 million. So again, there isn't that strict requirement for privacy and breach risk assessment to be performed regularly, but it is a great idea. Okay, make sure that you're doing that. You have the right HIPAA and state-specific privacy and breach notification policies and regulations in place for your organization. Okay. Just a quick question here. We'll do a poll question. We'll leave this up, and then if we've got some questions, Sierra or Siobhan, we'll take some of those. But if you would open up the poll here, if you guys let us know if you want us to chat. If you're not interested, that's fine. Hopefully this is a very helpful discussion for you. But let us know if we can connect and help, or if it's at some other future time. We're happy to do that. But while that's up, Sierra, Siobhan, if there are any questions that we can take, or if you guys have questions, now is a great time to chat those in as well.
Yeah, it looks like a couple have come through that are use case specific, so we'll make sure that we reach out about those. One question is with the SRA and PBRA, can you do them side by side, like at the same time, or do you need to do one before the other?
Awesome question. The answer is yes, you can, but the caveat is maybe you don't want to. Okay, so what I mean by that is it depends on who's going to be working on it in the organization. If you have one person that is your HIPAA security and privacy officer, it may not make sense to do them in tandem, but rather sequential, just so you can complete one, move on to the next one, start them right after each other is our general recommendation. You know, again, different people involved, do them at the same time. Get them both done. It's great for the organization just to have that HIPAA piece as opposed to dragging it out, but really is organizational structure specific. System-wise, our side, we're good either way, but those are our recommendations.
It looks like there's a question, can PBRA be used for HIPAA or GDPR?
So that is a HIPAA specific privacy and breach risk assessment. We can definitely help with GDPR as well. It's not in this system, so it's not quite as efficient in terms of the platform, but we do help organizations with GDPR compliance regularly.
Okay, great. And one more question. Are you only required to complete an SRA if you're participating in MIPS?
Oh, yeah, great question. The MIPS requirement is specifically that you have to have it done in each calendar year. Everybody who handles patient information, EPHI, is required to conduct a security risk analysis regularly. So no, MIPS just ups the ante and puts more penalties in place if you're not doing it, more monetary penalties if you're a MIPS participant. But everybody who has access to that data, or whether they're creating it as a covered entity, whether they're using it as a payer, or even as a business associate supporting either payers or providers, you've got to conduct a risk assessment regularly. 100%, great question.
Hey, it looks like those are all our generic questions. So we'll reach out to you if you asked one specifically about your organization, and we'll get those answered. And then Kirk has some contact information if you're interested in learning more about the SRA, PBRA, just have questions specific to HIPAA. We're more than happy to answer those for you. We also have a lot of resources on our website, enterprisehealth.com, or if you want to follow us on LinkedIn, we have a lot of up-to-date information, not only about new regulations and things that are coming out, but also webinars and events that we have. So thank you, Kirk, for presenting today. We appreciate all you've shared. And again, if you have any questions, feel free to reach out and we're more than happy to help.
Thank you, Sarah. Thank you, everybody, for joining us today.